My name is Reena Thelhamani. I'm a colorectal surgeon at Chesapeake Regional Healthcare. A colorectal surgeon has fun in the operating room and in the office, and hopefully makes that appointment for the patient also reassuring and less anxiety-provoking. As a colorectal surgeon, I have chosen to specialize in pathologies or diseases that affect the colon and rectum and the anus. And so, providing the service when you are examining, for example, for hemorrhoids or fissures or fecal incontinence, and doing these exams that often patients will feel embarrassed about. I think the specialty allows you to come in and provide that in a compassionate way, and also then reassure people when they're coming in for things like colon cancer. So this specialty is very, very compassionate, and requires, as a colorectal surgeon, to be involved in their care and also become often a long-term physician that establishes a relationship. For example, your colon cancer and rectal cancer patients, you will see them for a prolonged period of time. And this specialty really allows for that relationship to occur. And I think it's good from a treatment plan and what we have decided as physicians to do, and it fulfills me in that standpoint. We can do a lot of things to make sure that we stay healthy. Of course, following the treatment recommendations or the screening guidelines for colon cancer by having your colonoscopies at an appropriate time, which now starts at 45 years, as we are seeing higher number of patients with colon cancer at age under 50 years. That's the number one thing. Having a healthy lifestyle, which includes regular exercising, maintaining a high fiber diet, having low fat content, and avoiding excessive alcohol intake and smoking. These are all risk factors that can cause cancer. And so maintaining this lifestyle is essential and very helpful in keeping your risk for colon cancer low. So colorectal cancer is the second leading cause of death and the third most common cancer. But it is preventable if we keep up with our regular screening colonoscopies. Patients will have polyps, and we will detect them and remove them as soon as we see them. These polyps are what develop into cancer if they are not treated or removed. And so screening colonoscopies are essential for patients, and I would strongly recommend that everybody follow the recommendations as given by their physicians. I really do feel that often, sometimes greater than 50% of my patients in a day are female patients. And I think, for example, I think my male physician colleagues are great, but I've never had a male physician. I myself am more comfortable going to a female physician. And as I said, colorectal surgery, if we're dealing with abdominal procedures, is pretty comfortable for most people to come in for the exams that are associated with it and all. But especially anorectal issues and incontinence as being one of the big ones, it is difficult to reach out to someone for an examination. It's so personal. It's you have to feel comfortable and be in a format that does not make you, scringe every time someone touches you. And I think that's why a lot of my population is female, and I'm glad that colorectal surgery is very supportive at this point of incorporating and training female surgeons, because I think the society understands why it is essential to have females in this field. I just want to, emphasize to the population in general that there are treatment options available at this time. We have medical options, we have surgical options, sacral nerve stimulators. These are all available at this time, and so reaching out to your physicians to get information is essential. And it can be done in a very compassionate format so that it's not an embarrassing situation, and you can come in for help and we can make a difference.